for the great weekend. These classes get recorded just because it's fantastic to have a chance to review them. As I said, remember to always take a look at the disclaimer that we always talk about. And my information as I give on each of the classes is provided always in the slides that I give to all of you. So you always get a copy of my slides. Most of the time, if you can't hit one of those links that I am always a link person, link to the CDC, link to the California Department of Public Health, etc., just you can email me and say, hey, I'm missing a link where you discussed A, B, C, and D, and I'll send it to you. I'm more than happy to always pass on information. My learning objectives of today. Number one, listing some of the steps employer must take in order to fully reopen by June 15, 2021. As you all know, we are gearing towards reopening, and with that, our economy is supposed to be somewhat back to normal. Here in California, we have the emergency temporary standard. I know other states have some temporary emergency regulations as well, such as Oregon and Washington. Here in California, we have a specific standard that deals with COVID-19. So today I want to make sure we talk in that context, in the context of how is it that this fully reopening by June 15 is going to affect you, business owner, you, nurse, you, safety director, you, lead supervisor, manager who is in charge of making sure that people stay safe and that the spread stops. The next objective is describing the relationship between the vaccination issue and the COVID-19 emergency standard for employers and employees, because as we reach more numbers of people fully vaccinated, we need to understand what fully vaccinated means. We need to understand our options, the variants out there. There's a wealth of information, and by no means we're going to cover all of this in 1 hour. But as I said, we always get to discuss things at the end through Q&A, or you can also email me. And Lindsay is wonderful and email me some of your questions and I get back to you. And don't be shy, please, because when you ask questions, we all grow. It's a wonderful win-win situation. I grow in knowledge, you grow in knowledge, and we all use that knowledge to apply it in our places of employment. And last but not least, reviewing some of the COVID-19 non-compliance issues that continue to occur in businesses and places of employment, and helpful tips to avoid an OSHA inspection. So those are the objectives of the day. At the end, we'll review that we fulfilled them. If you have any questions, let me know. By the way, I'm also very open to you guys interrupting. So make sure that if you need to interject something that you've learned or say something about the issue, please do. So reopening of our businesses will heavily rely on a couple of things. There's that criteria, right, that needs to be met. But we're trying to really get rid of that tier system by June 15th. We're still complying with that tier system. And so for your places of employment, if they are a brick and mortar type of place of employment, you have to check what tier you're in. If you have employees going to different counties and different areas in the state, you still have to comply with the regulations for the county that they are traveling to. Masking and vaccinations will continue. So, wearing masks, coverings, and distancing and vaccinations need to continue in order for us to fully reopen. So it's a reopening under this new COVID-19 world. It really is. There is no going back to how things were in 2018 or 2019 that we can say will happen right now. Places of employment are still under the requirements of the emergency temporary standard, and that's what I will be referring to. ETS means emergency temporary standard that is required here in California. So because of that, you will know, if you've read the whole standard, you know now that you have requirements that are very strict for when to require face coverings, when to require and how to comply with physical distance issues, etc. So California aims to fully reopen June 15th. The move forward comes as the state has reached 20 million vaccinations, including 4 million in its hardest hit communities. So We talk about communities where the rate or the case rate was much higher than the rest, either because of it was interesting, but the race, ethnicity had to do with the type of jobs also, and just the rates were higher for some communities and states. So four of those including 4 million in its hardest hit communities. So masking and vaccinations will continue, hospitalization rates must stay low, and vaccination availability needs to stay high for the state to fully reopen. So right now, everybody that is 16 and above can access and schedule their vaccine, right? So we have a couple of steps that I promised to go over as we continue to reopen by June 15th, because that's the goal, right? On June 15, all industries across the state can return to usual operations. That's the goal. That's the goal. It doesn't mean that it couldn't change. This is just something that it's a goal. We're aiming to do this, but if things change and the criteria is not met, we will not be able to reopen by June 15. In order to reopen, aside from the criteria, once we get to June 15, we will continue to use common sense. And if you have been in many of my classes prior to this, when you know that I don't believe very much in common sense is more like a superpower, right? Very few people possess it. Common sense relates to the fact that you know better, you do things because your training, your experience allows you to do them in a safe way. Well, common sense is heavily dependent on the training of the person or the prior experiences, and how focused and non-distracted the person is at the moment he or she's performing their job. Remember, I'm only focused on people at work. These talks are not for the public. These talks are for us, workers and employers. That's why it's called Employers Corner, right? So instead of common sense, I like to say through training, we help our employees comply with the rules that we set in order to protect them and keep them safe and healthy. The state will monitor hospitalization rates, vaccine access, and vaccine efficacy against variants with the option to revisit it this June 15 if needed. So we know we have some variants out there. There are many of them. They're divided in three groups, right? So it could be variants of interest, variants of a concern, and variants of high concern, right? Or high consequence, actually. And so the ones high concern are being studied right now by the CDC. But when I was doing my research for today's class, I found that there's really not much out there that will help us understand the variants that we're dealing with. Yes, you can get into a lot of the studies that are out there. There's a lot of information, but nothing is conclusive that can be put to be widely distributed amongst our employees, our employers, etc. We can continue to study it, but the truth is, the CDC page mentions that some studies have demonstrated that the current vaccines are efficient against some of these variants or strains, right? And so that's good news, but I didn't see a link right there in that page as to those studies for us to actually take a look at those. And so I don't have a link for you because I didn't see those studies. Nevertheless, that's very hopeful. But what this tells you really is that we have yet much to learn about these variants. And so some of them come and go, disappear, but some of them stay and have stayed with us. So we need to keep an eye out on any changes because the emergency temporary standard that OSHA issued in November 30th to be implemented starting December 1st, 2020 is still in place, and it makes a lot of sense because of these issues, because of the issue that the vaccine does not protect you against getting coronavirus, especially if you've been just recently vaccinated and immunity hasn't developed. And so you're not immune yet, and you can still be under the risk of contracting the disease. Another thing, so we will talk about that when we talk about what's fully vaccinated or what fully vaccinated means. So let me move on to that because this is very important. That last bullet point is really important that we all kind of take a look and step back and really think about it. We have variants, we don't have a lot of information about it, and things may change pending that research, etc. We're very hopeful, and there's a lot of good stuff out there in the California Department of Public Health and the CDC telling us that really with all this the vaccination rate going up and the actual supplies really coming to Californians, we are pretty much really set to reopen by June 15th. So anytime you see the acronym CDPH, that means California Department of Public Health. And when you see ETS, that means emergency temporary standard, right? And when you see CDC, Centers for Disease Control. So you have any other questions as to the acronyms I mentioned, please do chat with me, put it in the chat so that we can answer that question. And Lindsay's always very good at advising me if I haven't answered anybody in the chat. This is the criteria to reopen by June 15. So there has to be equitable vaccine availability. The supply needs to be, right now, the supply is sufficient for anyone 16 and older. So you can go to My Turn and get your appointment. The other thing is we don't know what's going to happen as to the availability for vaccination for those under the age of 16 years of age yet. So we don't have that information at the tip of our fingers. We know that many manufacturers are still working on that. And two, consistently low burden of disease. So this is the criteria: equitable vaccine availability, and number two, consistently low burden of disease, which means hospitalizations need to be where the rate's still stable or lowered, and specifically hospitalizations among fully vaccinated individuals need to be low, right? Need to stay low. So I have this link that I have put there for you, which basically takes you to this what happens beyond the blueprint, right? And when California reopens fully, the state will move beyond the blueprint for safer economy. What that means for all of us listening today is that the tiering system will drop and we will no longer use it, but we still need to be very cognizant of what applies. Because if the tier system, which gave us an idea of how many people we could have in our buildings, if we could have people working at our places of employment versus remotely, or all of the guidelines that we took a look at will no longer apply in that sense, but they will apply under the requirements of the emergency temporary standard. And the emergency temporary standard, let me tell you guys, is quite specific. So lots to learn. There is no more excuse for employers to say, well, the emergency temporary standard is a new law. I haven't really gotten fully compliant with it because it just got barely implemented by the end of last year. Guys, we are in April, middle of April. There's no excuse. As a matter of fact, I'll talk about the citations that OSHA is issuing, because what's happening now is they were not charging, they were not really connecting money with those citations while the standard was actually quite new for 2 months. But beyond February 2nd, everybody who's not compliant is going to get cited and penalties will be issued by California OSHA. So I love this link that I gave you guys here because it gives you that access to the California Department of Public Health link. And it takes you to a little bit of understanding what it means to move beyond the blueprint for a safer economy, right? And so it's got the materials in Spanish, as always. There's the criteria that we talked about. And then it really says basically all sectors listed in the current blueprint activities and business tier chart. My gosh, my English is going. They may return to usual operations, but here is the caveat: in compliance with the Emergency Temporary Standard CalOSHA and other statewide agency guidelines. So remember that the ETS CalOSHA, or the Emergency Temporary Standard that they talk about here, is actually mandatory versus guidelines. The California Department of Public Health and even CalOSHA and the CDC, all of those have a lot of documents for different types of industry that are guidelines, right? So anytime you see guide for COVID-19 for the manufacturing industry or checklist for the construction industry, those are guidelines. Those guidelines, or if they're under, for example, if a checklist is under the context of a guideline from the California Department of Public Health, or you found it most likely in the COVID-19.gov site, those are guidelines. So you take from those and you apply them as best as you can, and you will not be cited unless these are really included in the ETS, right? So you will get a citation from CalOSHA if you're in violation of any of the requirements of the emergency temporary standard. They will not cite you when you fail to comply with some of those guidelines. Nevertheless, they are very similar. So I would really highly recommend that you review your COVID-19 program and you make it very, very similar to the requirements of that model program issued by OSHA versus leaving it like you had it prior to December 1st, 2020, and kind of tweaking it to the emergency temporary standard. You've been with me in prior classes, you know that I'm big on this because the model programs that OSHA issues even have the OSHA symbol, and it tells you the date of the revision. And that allows for your company to provide that document to OSHA in case you are audited or in case you get a COSHA on site, which is the compliance, safety and health officer from OSHA. So all sectors need to comply, and I'll show you the blueprint activities and business tier chart in a moment. It's important to see it because depending where you're at, we'll see what you still have to do between April 16th, meaning today, and June 15th. Okay. So it is in addition, the following restrictions apply via an Aero Public Health Order. Unless testing or vaccination status is verified for all attendees, conventions will be capped at 5,000 persons until October 1st. So because when you look at the chart and because they're opening up for all sectors, that includes conventions, gatherings, events, live events, concerts, and you know, and it's kind of scary. So that's why from right now till June 15th, we have strong restrictions for live events and gatherings and concerts, etc. And so this is telling you, although we move beyond the blueprint, and even if we get rid of that tiered chart, we still have these events capped at 5,000 persons until October 1st, right? International convention attendees will only be allowed if fully vaccinated. There's a lot of very strict information regarding international travelers and people out of state. So we really need to take a look at that as well.
Are we supposed to be seeing a chart? Because we see
I'll show you the chart. Sure,
Oh.
sure. Thank you. Okay, here we go. So thank you for mentioning that. Here is the blueprint for a safer economy business tier chart. And it was updated April 13th, 2021. So this is brand new stuff. They added some, not everything is new in this chart. The only things that are new are the things at the very end of the document that tell you what's new. And I'll show you in a moment. Let me see, let me go there. By the way, does anyone know what tier you're in Los Angeles? Can anyone tell me your tier? If you've looked that up? And if you are not in Los Angeles, can you tell me what's your tier in Orange County? I, for example, was saying that Riverside County moved on April 7th, moved to orange tier. So went from purple to red to orange. So that is really good. And so all of you, depending where you're working at or where your workers are at, you need to know where you're at. So Los Angeles is in orange. Thank you, Kelly. You guys are awesome. So the Los Angeles is in orange, right? So this is why this tier system really helps, because it gives you an idea of what type of modifications you need to implement depending on your sector, right? And San Diego is also in orange. This is great, right? So here at the very end of the document that I have on your screen, you have updates that were made on April 12th. Those are brand new updates, which is location and capacity limits on places of worship. So for churches, it's telling you they're not mandatory, but strongly recommended. So you see how less restrictive this is. So from April till June 15th, we are moving slowly towards really getting rid of this system. And then for gatherings, limits will not be enforced to the extent that they have been enjoined by a court, which means unless you have a court saying you cannot hold this gathering, you know, there will be no enforcement as to you cannot hold this gathering per the updates. And I'll show you what are the updates for gatherings, because they divide it into social gatherings, then meetings, live concerts, etc. Updated on April 2nd, they had updated gatherings effective April 15th, meaning although they updated the chart on April 2nd, it wouldn't take effect until April 15th. That means yesterday. So this is really cool, very up-to-date information. Added private events and indoor seated live events and performances effective April 15th. Updated family entertainment centers. They also added that portion in the charts, and added affairs to amusement parks. So affairs are also added in the business category of amusement parks, right? And since March 11, we had, regardless of trigger being met, these activities cannot begin sooner than June 1st. Okay, so those are kind of like the notes that you want to know. Okay, so what's new? What's new so that I can go back and visit it if you've been visiting this chart quite often. So let's say you are a restaurateur, right? So I would say restaurant in my command find, and I see everything that has to do with restaurants, shopping center, malls. You go to, if you have a food place or a type of restaurant, for food courts, for example, you have to go to restaurants. So this is great. I love the find, command find, right? Restaurants. So if you are in widespread, with which most of your accountants or most of the people on this call are not anymore in purple, it would be outdoor only with modifications, right? So I don't know about you, but it has felt very nice to go inside a restaurant and sit down and choose from indoor sitting or outdoor sitting. And it's really nice, actually, that yesterday I went to Wahoo's and I was running around doing some things for work. And I stopped by Wahoo's and they said, is this for takeout or indoor, or what did she say? I even forget the phrase, but I was so happy to hear. It's like, no, it is not for takeout, finally, right? So this is good news for a substantial tier 2 open indoors with modifications. So now we have a lot of these restaurants opening with modifications. For example, maximum 25% capacity or 100 people, whichever is fewer. So if your restaurant is very small, you wouldn't have the 100 people capacity, but maybe the 25%, right? So few people can sit indoors. By the way, you are, as a restaurateur, unless you have a major outbreak, you're not required to look into installing a certain kind of filter for your indoor ventilation filters. But outside of that, you are required, per the emergency temporary standard, to take a look at increasing the ventilation. So keeping those doors open, which is going to be very interesting during this hot summer months. So the best you can do, business owner, is to take a look at the recommendations. There's a full page by the California Department of Public Health of what you can do right now, even if you're not required per the Cal OSHA standard, to improve ventilation indoors. And they actually talk about restaurants being one of those types of industries that should be taking a look at improving their ventilation systems, even if not required by the Cal OSHA standard, because Cal OSHA standard only says to increase the ventilation of outside air. But whenever you get into a major outbreak, you're required to actually take a look at installing MERV 13 filters. So this is great information for everyone. And we have tier 3, open indoors with modifications, max 50% or 200 people, whichever is fewer, and minimal open indoors with modifications, max 50% capacity. So this is exactly where you need to look at from right now, April 16th till June 15th, unless there's a change, because remember, there's a criteria that needs to be met in order for us to move forward with that June 15 deadline. So watch for changes. And of course, in 2 weeks, we will hold this webinar again, and we'll be able to tell you whether or not that has changed. But for right now, we want to get rid of this tier system that we have on your screen. And so in order to move with that, we need to get the vaccinations going. And apparently that's going really well. Supplies are there. People that are older than 16 can get vaccinated. And the second part of the criteria is that the actual hospitalization rates stay low and do not change from what we've seen right now, right? So all of that, it's really being closely looked upon with these strains and variants that we do not have a lot of information on. But as I said before, according to the CDC and the page regarding these variants, we do have some hope that some studies show, and they don't give us a link to the studies, but nevertheless, some studies show, as they stated in their page, that these vaccines that we have right now are actually tackling some of these strains. So good stuff for everybody. I love this part. Wineries, breweries, and distilleries, right? Outdoor only with modifications if you're in the purple. Let's go to the orange since you're in LA. So the wineries, breweries, and distilleries are open indoors with modifications. Yay! So we can actually go this weekend and get sauced. Well, That's not really my recommendation. It's just a joke to keep you awake. But the truth here is maximum 25% capacity indoors or 100 people, whichever is fewer, right? So this is quite interesting because then they remove those other very specific requirements when you're in the purple tier. So if you were in the purple tier, which most of the counties are not anymore, you'd have to have reservations. It had to be only outdoors. You had to have reservations. There was a 90-minute time limit. Does anyone care to tell me if you ever had anyone tell, okay, so your 90-minute limit is up, get out? But that's interesting. They put a 90-minute time limit. And then the seating tables only. So that means you can't be at the bar, right? Or sit on a bar stool. So most of the time, these wineries, breweries, and distilleries are a restaurant, right? You can sit there and eat something. And limited hours. So if you are a winery, brewery, and distillery, you cannot be open beyond 8 p.m. according to requirements of Tier 1. But as you move forward, all of those get shed or faded out, and then you move into just having the indoor reopening with modification, only max 25% or 50% if you're in the minimal tier, right? So that's what's happening right now between now and June 15th. So that's so funny, right? It must be what's important in my life that I'm so focused on restaurants, wineries, breweries, and distilleries. No. I know you're all making jokes and smiling about this, but we're all interested in that. The food, that's what I mean. But here is the gatherings. It really it starts with the gatherings, right? And don't forget here, anybody in critical infrastructure, no matter the tier you're in, you have to continue to be open with modifications. And what that means, remember, the actual emergency temporary standard for OSHA has been in place since December 1st, 2020. So that's what it means, open with modifications. Employers have certain specific requirements in order to get you to work safely. Let's see. I think I have a question here. Gymnasiums and pools, that also has an actual requirement that it is it's getting to be less restrictive depending on the tier you're in. So we can say spas or fitness centers. So as you can tell here, for hotels and lodging, so if you're in the purple, you can open with modifications. But if you are in the which means open with modifications means it's still quite restrictive per the emergency temporary standard. If the case rate is 6 to 10 under tier 2 substantial and it's red, you can be open with modifications, and fitness centers more than 10%. And then if you are in the orange, open with modifications, right? So that includes the gyms and the indoor pools. And that's what you do with this chart. You take a look at what you are, the type of business you're in. You could do your control find, and you take a look at the tier, and then you find out what does it mean. What are the current restrictions that you have? So shopping centers, personal care services, museums, places of worship, movie theaters, etc. But this is the one that I wanted to go over. So for social events, social gatherings, outdoor gatherings, if you're in the purple, outdoor gatherings only with modifications, maximum 3 households, effective April 15, okay, outdoor only. There's no defined guest list. This is what is called a social informal gathering, when there's no defined guest list, no testing or vaccination required. So for us at work, which is what I focused on during these talks, you talk about these events not being really social gatherings. These are private events. They're considered meetings, work meetings. Sometimes their receptions or conferences in person. If that's the case, you have some required mitigation measures. And so for this type of events, you mean some of these things are in place, like purchase tickets or defined guest list, seating chart, assigned seating, testing and vaccination can increase capacity. And they tell you how. No intermingling on multiple private events. So when you have this chart, and from now till June 15th, you really need to combine your program, your COVID-19 prevention program, with your tiering and the recommendations here. Because, for example, since we're in tier 3 for Los Angeles, it says outdoor maximum of 100 people. If it's a private event, let's say a conference that you're holding, maximum of 100 people. But mind you, you are having a guest list that is defined. You have seating chart, assigned seating. And then remember that if all guests are tested or can show proof of full vaccination, you can get that maximum up to 300 people. So this is where the vaccination is really making a big difference, right? So that's for the private events. Indoor seated live events and performances are closed for anybody in the purple tier, meaning if your location or wherever you want to go to those live performances is in the purple tier, is closed, is not allowed. But effective yesterday, all venues, if it's in-state visitors only, so California visitors, you can check with the California Department of Public Health Travel Advisory, and that gives you some extra information in regards to fully vaccinated, not fully vaccinated people, and out of state. So in-state visitors only, right, for all venues. Weekly worker testing program. That's interesting to me because that's an additional requirement outside of the Cal OSHA ETS, the Emergency Temporary Standard, which means for you, indoor seated live event and performance employer, you actually have to take a look starting today, because this went in effect April 15th. So starting today, you have to take a look at the weekly worker testing program that you have to have in place in the meantime till we get to June 15th. You see how then there's steps, really steps from now till June 15th that we reopen. It's not as simple as, oh, by June 15th, we're just going to drop this system. We're going to go beyond the blueprint. And that's it. It's not that simple. There's actual steps and requirements. So the weekly worker testing program, we have a weekly worker testing program that is required by Cal OSHA, but only if you have an outbreak. And that happens when you have 3 or more people within a 14-day period that have a positive COVID-19 test, and they have been and it's happened at the same location. So because that's called an outbreak and it's actually regulated under 3205.1, that's the actual number for that regulation under the emergency standard, you're required to put in place a weekly worker testing program. Guess what? From April till June 15th, from right now till June 15th, you're also required to have this put together if you're organizing any of those indoor seated live events and performances. And you can take a look at the rest for all venues in the orange, in-state visitors only, check for current. And when it says that, it's because they talk about international travelers too. And what right now is happening is California is highly discouraging people from other countries to come into California. It's a little bit like we've managed to get so far, and we know that there are some countries and we know that there are some areas with high numbers. So we really want to discourage international travelers from coming to California if they're not fully vaccinated, or if they don't test negative and give the proof of testing before getting on a plane or getting through a border. And then aside from that, we're asking them to quarantine. So the CDC and the California Department of Public Health Travel Advisory have these requirements in writing. So good homework for you to take a look at, right? Because this is all in regards to venues. So what I can see in this chart is that the actual strict requirements really remain out there in case you want to organize anything in person. So really, this applies to all of us. I know in-person events are really awesome. We get to see each other, etc. But remember, depending on the tier you're in, you may have to have a way to control the flow of how people get to your conference and how people leave, because you're not permitted to have intermingling with other events or other people. And this is in this chart. So make sure you look at this because it's in place today. It went in effect yesterday. I don't want to not finish my PowerPoint. Here we go. So talked about that. There's much to learn. I really read the entire chart. So you really, depending on your business, you really need to go in what does the chart say to implement that along with your California OSHA mandated program. Be vigilant of that tier system, of course. So this is basically a summary of what I have for you in regards to what you need to do from April 15th till June 15th. And remember that June 15th deadline is flexible. They're not saying by June 15th, for sure, we're dropping all of this and that's it. We're moving to our usual selves and we're back to normal. That June 15th may change, number one. And number two, if the tier system drops and just fades away and we're not going to be using it anymore, the Cal OSHA emergency temporary standard still stands. It's still in place. And it's going to continue to evolve because a lot of the issues with vaccination and fully vaccinated workers have not been included in the standard. Because right now, Cal OSHA hasn't put anything in writing as to how to deal if you have, for example, a fully vaccinated workforce. They haven't put anything in the standard where that may be your goal, but the truth is that's going to be hard to achieve, specifically because there are some issues of people opting out of the vaccination recommendations. And if that's the case, how are you, employer, going to get to your goal of fully vaccinated employees if it's not a law? And requiring it as a policy, internal policy, well, technically you could require it, but legally you're going to see yourself in a very nightmarish legal battle. And you can talk to your HR department and your legal department and how that is not feasible right now for you to require that all your employees get vaccinated. So let's see. So we say all gatherings, events except social tier system may enhance capacity if proof of test or vaccination is provided. So that really applies to your clients, the people that you are actually providing services to, because and your employees as well. I'm sorry, if the gathering or the event is for employees. So remember to take a look at the new travel advisory that was added in April 1st, 2021. So this is all really very constantly changing information. I would say the same person and persons in charge of your COVID-19 program should be the ones always updating this information in your programs. Always go back to your computer and update. New travel advisory, April 1st, 2021, which is the one that strongly discourages international travelers. And it's an interesting thing because persons who routinely cross state or county borders for essential travel do not need to quarantine. And that's all in that advisory. Let me take you there because I did put the link. If you can't get it to open when you play the slides, which I'll send to you, just let me know, because I am interested in you taking a look at, if you have people that travel, essential travel for work, you need to read this. They need to be owning this and know it by heart. It was updated April 2nd. And so they recommend delaying travel until persons are fully vaccinated. That's the key here, right? They want you to be fully vaccinated. Even the CDC has a page that says, if you're not fully vaccinated, we want at least proof of negative test 3 days prior to getting on a plane. And so a lot of the airlines are actually implementing these as part of their own policy. And then it goes into non-essential travel of unvaccinated persons. So that wouldn't be you, because we're talking about employer, right? This is for all of us that want to go see our family or whatever that is non-essential. But what we do care about is when it is essential travel, and it says your essential travel is associated with the operation, maintenance, or usage of critical. So it tells you what that means. And that's when it says persons who routinely cross the state or county borders for essential travel do not need to quarantine. That doesn't mean that you don't need to show proof of a negative test or that you do not need to be fully vaccinated. It just means you don't have to quarantine, because quarantine is highly recommended, even if you're vaccinated or if you test negative. Actually, for vaccinated people, they're not. So let me take that back. For fully vaccinated people traveling, they don't require you to quarantine. But if you're not vaccinated and you return, even showing up a negative test, they do recommend that you quarantine. And so that's why it was interesting to me to see that persons that do essential traveling and routinely cross the state or county borders are not required or do not need to quarantine. And, it's not to interrupt the flow of work and the essential needs for infrastructure, medical services, etc. That's the key there. Not because they're not recommended to do so, but because they don't want to interrupt the flow of work, of essential work. Okay, so do let me know if I'm getting confusing. I hope not. I've tried to be, but sometimes, my head is thinking ahead of what I'm reading. So please do let me know. Weekly testing program for employees, I talked about that. And then I talked about bars, breweries, and all of that as well. All office work is to continue to be remote at all times if possible. So always weigh if your workers can stay and work from home. Even if you, because a lot of the times employers right now being forced to send workers to work from home because there was somebody that tested positive at work, and so you're kind of sending as many people to work from home, either because of your exclusion from work policy, etc. And don't wait till something like that happens. Still, any office work that you can continue to keep remote, keep it remote. And by the way, that's going to go beyond June 15th. They want you to still keep as many people working from home as possible. And I think it has to do with a lot of the information that we don't have in regards to the variants, but that's just my opinion, right? When are you considered to be fully vaccinated? So you are fully vaccinated if you are 2 weeks after your second dose in a two-dose series, such as the Pfizer or the Moderna vaccines, or 2 weeks after the single-dose vaccine, such as Johnson and Johnson's Janssen vaccine. I think that Johnson and Johnson is right now, the California Department of Public Health is asking not to be used. I have to go back to that, but I believe that one is out of circulation here in California, meaning they don't want you to take that one, but to take Pfizer or the Moderna. I remember reading something in the California Department of Public Health page. If you don't meet these requirements, you're not fully vaccinated. Keep taking all precautions until you're fully vaccinated. Yes, because they've seen that some people still get COVID-19 within days after their vaccine happens. So you're not fully vaccinated if 2 weeks haven't passed after your second dose, right? So what if you just did one dose and you got sick, you had some secondary or adverse effects that went away, but maybe you got scared and you didn't do the second dose, then you're not considered to be fully vaccinated. Okay. So even if you're fully vaccinated, we're still learning how vaccines affect the spread. After you've been fully vaccinated against COVID-19, you should keep taking precautions. That link just takes you to the regular How to Stop the Spread by the CDC. Wearing a mask, staying 6 feet apart from others, and avoiding crowds and poorly ventilated spaces in public places until we know more. One of the things that I want to make sure that I continue to put an emphasis is in places of employment. So this is not, doesn't apply to anybody else from the public or etc. At work, if you're in charge of this program, of the COVID-19 program, make sure people put on their masks, even at the break rooms. I know break rooms for a lot of you are kind of like the free zone, and Cal OSHA has been receiving many complaints in regards to break rooms because break rooms are there for people to rest, take a break, and eat or drink. And you can't wear a mask while you drink or eat. So people take them off. But what happens? Once you take it off, you start talking, chatting, getting friendly again, because we miss that. It's simply human nature. So what you want to require workers is if they're not eating or drinking, even if they're in the break room, they still have to keep their masks on. And this is just one of the tips I've given you before, because this is where we get complaints to Cal OSHA. Remember, we're all in different, I don't think we've ever been through a period of time where our nation has been more divided because of the opinions as to, hey, this is a free country, I have the right not to wear a mask or whatever it is. And as we take a look at these issues and we are in this 1 hour space of what is required for employers, we've talked about this is about us keeping our nose clean, meaning I understand you have the right to all these things, but while you are under my employment, this is what I require you to do. Why? Because it's a law here in California. That's all it is. And that's what I always say. Our motto is, keep our nose clean, do what is right and mandated and required right now by the regulation. The rest, of course, that's up to people. And of course, we all can have these discussions. But at work, we obey what the current regulation is all about. Updated healthcare infection prevention and control recommendations in response to COVID-19 vaccination is in this link that I gave you. Why is it important? Because I have a lot of healthcare attendees, yourselves. Please take a look at this link. It's an amazing link because the emergency temporary standard is a supplement to the current aerosol transmissible disease standard or regulation. So those two combined cover everyone that works for you, because before you only had your nurses, your orderlies, your doctors who had to be under this exposure control program for the aerosol transmissible disease standard, which covered anything from TB or which is bacteria that is so small it can get into the lungs. But now we have this virus, which we know it's transmitted by droplets, but as the research went on and on. We know that aerosols or the sneezing or the coughing or those droplets can also aerosolize or produce aerosols that indoors can travel more than 6 feet. And we get into issues of infection prevention and control. And they are more strict for healthcare, especially because in the healthcare sector, you have, for example, nursing homes. And in nursing homes, you will see that you have highly immunocompromised patients, people that can get really, really sick if they get COVID-19 and they could die. So because of this, the criteria and the actual strategy to mitigate or to go from very strong restrictions to fully reopen and admit visitors, for example, to a nursing home, we take more careful steps. That's basically what this link will tell you. Right now, if you're in the purple tier, or if you have a case rate that is more than 10% in your county or your city, and it'll be very specific. Remember, this is the CDC. So what it says is, we're still going to do just end of life care. Visitors can only come if it's end of life situation. But if it's outside of that, we're not encouraging visitors to come to a nursing home or a skilled home facility, depending on your geographical area and the case rate, right? But right now, what we're saying is, because we know the benefit of visitors, and we want to encourage that human contact in healthcare, we really need to take a look at how our infection control is going to evolve with this pandemic. And it's a little bit more strict than the rest of us that obey the emergency temporary standard. So, and how do we know that? Because the emergency temporary standards is not really for healthcare. What we have for healthcare is the aerosol transmissible disease standard. And that is heavily tied to the infection prevention and control recommendations and current practices by the CDC and by that standard here in California, which is the airborne and aerosol transmissible disease regulation. More in that regard, just an example, for example, for a post-acute care facility, including nursing homes, indoor visitation could be permitted for all residents except as noted below, for example. So it could be permitted. So that's the goal, right? We want to go back and visit our great grandma, and indoor visitation for unvaccinated residents should be limited solely to compassionate care situations. Why? Because we're talking about if your positivity rate is more than 10% and less than 70% of your residents in the facility are fully vaccinated, you have some high risk there. So you want to limit visitors solely to compassionate care situations. And then the other thing is, indoor visitation should be limited solely to compassionate care for vaccinated and unvaccinated residents with COVID infection until they have met the criteria to discontinue transmission-based precautions. For those of you not in healthcare, this is quite the thing, right? Transmission-based precautions basically tells you how you care for that patient. And it goes from symptomatic versus test strategy, and test strategy is not really recommended because how we shed the virus, and that could give you a false positive, and then you keep isolating that patient when he or she doesn't need to be isolated. So it's symptom criteria versus test-based criteria. So I really highly encourage you to take a look at that link if you're in healthcare, because what you need to update is your actual aerosol transmissible disease exposure control program, and not really, and your policies on visitation, etc., and infection control, not your emergency temporary standard model program or the program that you have for COVID-19 for those outside of healthcare. A lot of info, right? A lot of great stuff now that we're preparing to get more towards normalcy, some sense of normalcy. So the ETS standard, or the emergency temporary standard, applies to all sectors once reopened. The tier system hopefully will not apply after June 15th, pending confirmation, of course. Having fully vaccinated employees does not exclude you from having to comply with the ETS standard. This is so key. That's why I put it in bold. So it just doesn't. Even if you were to achieve right now, today, April 16th, a fully vaccinated status, all your employees can show proof of being fully vaccinated. You couldn't say, I'm not going to listen to this regulation. It doesn't apply to me because I don't have to. It does. So the regulation hasn't changed. It hasn't included anything in regards to employees that are fully vaccinated. So keep watching. It might change. I believe because it's an emergency temporary standard, there will be changes made. but people continue to get cited by OSHA, right? So monetary penalties started February 2nd, 2021, even though the standard went into place in December 1st, 2021. All employers are expected to comply with all provisions of this standard, taking in consideration your good faith efforts. So what does that mean? It's like, well, I always have good faith. You know, I'm a really good person, so I do whatever it takes. Well, what that means is they want to see your efforts towards complying with the full standard, and there's a list of requirements. So if they see that you haven't done anything from the moment it went into place in December 1st till now, then that's not showing good faith. Or what if they see a really great program, well thought of, designed and written, but in practice, none of those things are being implemented. So that would show that your good faith efforts are not there, right? So OSHA does see that. How are you implementing it? And the actual records that show the steps you've taken. So here, just an example of a few citations that are very current in April 5th. These are all COVID related. So the type of inspection tells you, you know, out of these 4 that are very recent, 2 are fatality initiated and 2 are complaints. So most likely there was a patient, most likely there was a worker, and this has to be a worker because when it's fatality initiated, that means that worker went and was hospitalized and died, probably for complications with, and that doesn't necessarily mean that the reason or cause of death was COVID-19. And then complaint, and you'd have to read the whole document. Is available to you for you to read and learn from it. And I would highly advise that you take a look at this link with the, all you have to do is Google OSHA notable COVID-19 citations. They all appear. Take a look at the type of business. If it's manufacturing, there's an example here in manufacturing, toilet preparation manufacturing. Oh, it couldn't be worse, right? Toilet preparation. By the way, guys, just a slight bit of information there. The virus is active even in fecal matter. So one of the things that, you know, through training and information, you want to make sure that people implement certain measures, such as, you know, flush with the lid down. So every time you flush a toilet when you go to a restaurant, put the lid down and flush. So because the virus is alive and ready to infect people even in fecal matter, and you don't want any of those aerosols coming out of that toilet. Something that came to mind right now just because I read toilet preparation manufacturing, right? Type of inspection complaint, which is why I always make sure I bring you these tips to all of you to learn from experiences. Complaints, people complain. Why do they complain? Because they're unhappy about how you're handling this. So where does this ends? If you're doing your job, that's where it ends. So the complaint could come to OSHA, they screen them, and if it's bogus, is something that they see that the person is just being retaliatory against their employers, that can happen too. They dismiss the complaint. But if it's a complaint that has some backbone to it, they will sure take a look into it. Document your activities. Please continue to identify, evaluate, and correct hazards. This is something that it is required per your program. Use the current CDC and CDPH guidance. So it's the Centers for Disease Control and California Department of Public Health. There's a lot of guidance out there. The California Department of Public Health uses a lot of per type of industry guidance, per type of industry checklist. Use those and continue to use them. And even if we go beyond June 15th, there's no reason why you should completely throw them out if they're working for you. And then the document I have here on your screen is actually straight from OSHA. And it's one, for example, that is not a law, a piece of law. It was in place since October 27th, available to you since last year. And it's basically tips on how to keep you compliant during this COVID-19 if you're in the construction industry. It talks about issues such as highly touch surfaces, such as a water dispenser, because heat illness is something that it is coming up during the hot summer months. We've had some issues of heat illness during early spring. Even in January, we have some heat illness issues. So it does give you some information as to, hey, you might want to think about water bottles instead of having everybody dispense from a spout, right? Unless you provide with a disinfectant that can be used between users of that dispenser. Things like that are still in place. Their guidance, it tells you how to do the job that you're required to do, which is, this one is a requirement. Continue to identify, evaluate, and correct hazards, straight from the wording of the emergency temporary standard. Another thing that I want you to continue to pay attention is the exclusion from work requirements. This is where we as employers just pull our hair, because the truth is, having a fully vaccinated employee who might have been exposed, you identify him as a close contact, And it might have been a very small portion of his day that he was exposed, but he's fully vaccinated. You still have to send him to be quarantined for 14 days. And those are the hard things right now with the standard, because it really impacts the way we do business. It's required per the exclusion requirements of your program. So exclude from the workplace employees who test positive, of course. Well, those, yeah, of course. And employees with COVID-19 exposure. And when you get into the definitions, when you read the standard, you'll see that that means, the high risk period, which is 2 days prior to when they started having symptoms and they came to work. Then you have to go 2 days back and say, okay, who were you in contact with? Who can we identify as close contacts? And if you've been in this call before, we talked about the 6-15-24 formula, which means close contact is a person that was within 6 feet or a range to 6 feet for more than 15 minutes in a cumulative time of more than 15 minutes for a period of 24 hours. And you follow the return to work criteria for returning excluded employees to work. And that's what continues to be hard. I get a lot of questions from my clients in this regard, because it seems almost impossible. Do I really have to send him or her back to exclude them from work and not be here when I need him or her so much? But they were identified as a close contact and they're fully vaccinated. Well, the answer is yes, because you're still under this emergency temporary standard requirements, which basically says ensure that all COVID-19 cases are excluded until the return to work requirements are met. And there's specific return to work requirements. These are different under healthcare. Remember that these are different under healthcare. That's why we said COVID-19 program is under the emergency temporary standard, applies to everyone, and healthcare has an aerosol transmissible disease exposure control program, which is more strict really because it's based on infection control premises and principles. And actually it's an infectionist that a highly specialized and trained person who has the upper hand in regards to healthcare aerosol transmissible disease exposure control plan. So right there, your exclusion of COVID-19 cases has these bullet points. You exclude them for 14 days after the last known COVID-19 exposure. So because it says that, you have to go back to those definitions and know that that means that high risk period. If they were identified as a person that a close contact, then they have to be excluded 14 days. I don't care if they've been fully vaccinated, nothing, that doesn't matter. It's still under the regulation. You have to comply with it even beyond June 15th. But I do have an idea that by then we'll have some changes to our standard, hopefully, that will help employers comply in a better way. Next, continuing and maintaining an employee's earnings. So you really rely heavily on your human resources department to tell you what that is, because there's different issues with the sick leave benefits versus COVID-19 leave benefits. So you have to have this handy. Employees need to, by law, need to be trained in what these benefits are all about. And these employees need to get that information the moment you send them home to quarantine. They gotta have this because they want to know about their earnings, the seniority. They're very big on this. OSHA is very big on this. The Office of Labor Commissioner is very big on this, and they're giving out information as to how to file complaints if you don't do this. Guys, I think we are at 12 o'clock. There is the return to work criteria that you already have in your plans. If you don't, you can copy it from the model program by OSHA. Did we fulfill our objectives? We listed the steps to take in order to fully reopen. We described that relationship between the vaccination and the COVID-19 emergency standard. And I for sure reviewed some COVID-19 non-compliance issues right now that continue to occur in businesses. So I hope you continue to stay safe. I'll see you in 2 weeks. Any questions?
Thank you so much, Alba. Yeah, you can email Alba or I if you have any questions, but we will send the slides out later today.
You guys are great. Thank you for your time, and we'll see you soon.
Have a good day.
Thank you, Lindsay. Enjoy your weekend, everyone.
Bye, everyone.